welcome to another episode of PT Luis. And for today's video, we're going to talk about osteoarthritis. So, let's get started. Okay, so for today's video, our objectives is to define what is osteoarthritis, what are the causes of osteoarthritis, what are the symptoms being presented for a person with osteoarthritis, what is the role of physical therapies for patients with osteoarthritis, and if the patient opt to undergo joint replacement, so what will be our roles as physical therapists? All right. What is osteoarthritis? So osteoarthritis is a degenerative joint disease which is most commonly affecting the weight-bearing joint. So what do we mean when we say weight-bearing joint? So one example is the hip, the knee, and then we can also give the carpometacarpal joint of the thumb as a weight-bearing joint, meaning these are the joints that has more pressure upon application of movement or mobility. So whenever we walk, whenever we run, it absorbs a lot of pressure. So these are weight-bearing joints and commonly is affected by osteoarthritis. Now, so what happens for people with osteoarthritis? So I have here a picture of a healthy joint and a joint with osteoarthritis. So let's see what's the difference. So this is an example of a knee joint. Okay, so this top bone is your femur and this bone below is your tibia or the leg bone. Okay, now at the end of each bone, there is a white covering called your cartilage or your articular cartilage. Now, for a healthy joint, as you can see, it is clearly complete and articulating with each other, so it's smooth and allows movement freely without any problem for the patient. Okay, so for people with osteoarthritis, there is a progressive destruction of the articular cartilage. So as what we can see in this picture, so the cartilage begin to break down as you can see in this picture, and if it gets worse, then there will be an exposure of the bone. Okay, now another thing is that as you can see here, because there's already more severe affectation of the bone, there's already a developing bone spurs or what we call your osteophytes. Now let's try to analyze the difference between a healthy joint and osteoarthritis when it comes to movement. So a healthy joint can of course move freely without any pain or difficulty. However, for persons with osteoarthritis, if you imagine that the articular cartilage is already broken, whenever they move, there will be an increased friction and it will cause pain for the patient. What else? Because there is already a broken cartilage, there will also be a decreased shock absorption, which now in turn puts greater impact on the joint itself. Therefore, the patient with osteoarthritis would definitely feel pain and would definitely have difficulty in moving the joint because of the narrowing of the space and the increased friction within the joint. Okay, let's try to observe a real knee joint through the x-ray or radiographic image. Okay, this is the anterior view and the other side is on the lateral view. Some of the significant findings that you can see on the radiograph of a person with osteoarthritis is number one, the thinning or the narrowing of the joint space. Now, as you can see, this is the femur on top and then tibia below, and there should be a joint line space here. But on this medial aspect, as you can see, there's a narrow space and even increased congruency between the femur and the tibia. And therefore, there are white parts here, darker parts here, which signifies the osteophyte formation. No? So meaning, because of the severity of the condition, there's already bone spurs being developed. Now, if you try to imagine a person standing and with decreased joint space in this area, so therefore, there is really painful weight-bearing experience that they would feel. Okay, now this is the other picture on the lateral view of the radiograph, and as we can see here, again, there's a narrowing of the joint space and the development of the osteophytes. What are the causes of osteoarthritis? Actually, based on the references, the cause of osteoarthritis is usually idiopathic or unknown cause. However, there are different risk factors that, of course, can increase the probability of a person developing or acquiring osteoarthritis. So, number one is overweight or obesity. Now, we discussed earlier the structure of the joint and how the articular cartilage also helps supports in the shock absorption. Now, if you try to imagine a weight-bearing joint, such as your knee, and then you have an increased body weight, it puts your knee joint into greater pressure. Therefore, it could lead to osteoarthritis. Another one is previous injury. So when we say previous injury, for example, there's a sprain or a strain happening on the area or the joint itself. Of course, because if you had an injury, you would have limited motion, you will have a decreased functional movement. Therefore, it could also be a factor in developing osteoarthritis. And lastly, is overuse of the joint. So what do we mean by overuse of the joint? For example, as an individual, your occupation requires prolonged standing or prolonged walking or prolonged kneeling. Therefore, if you try to imagine, that puts a lot of pressure again on the specific joint that you are using. So, for example, let's say for 8 hours or 6 hours, you're standing for a long time. So, there is an increased pressure on the joint. Therefore, there's already a tendency for your joint to develop osteoarthritis. Okay. What are the symptoms of osteoarthritis? So, number one is the development of joint pain, as we have mentioned earlier. When it comes to joint pain of people with osteoarthritis, it is usually activity related, meaning the more you have an increased activity such as walking or just standing or any weight-bearing activity, after that activity, it would have an increased tendency to have pain. Okay. Another symptom is your joint stiffness. So for joint stiffness, usually it only lasts for less than 30 minutes compared to rheumatic arthritis, which has flares or attacks, no? But for this one, for osteoarthritis, remember there are development of bone spurs or osteophytes. Therefore, there's a tendency for the person to have crepitus or cracking feeling on the joint itself, okay? Because there is development of bone spurs, so you can see bony enlargement on the area of the affected joint for patients with osteoarthritis. And of course, because there is bone spurs again, there will be increased tenderness or pain upon palpation when you try to touch that joint itself, okay? And then lastly is for severe cases of osteoarthritis wherein there is really a decreased joint space or narrowing of joint space, and usually it is affecting the medial side of the joint or the knee joint. Therefore, what will happen is the patient would develop a deformity. So commonly, the deformity being developed is genovarum or the bow-legged. Now, the question is, what will now be the role of physical therapists in addressing osteoarthritis? Now, let me have a little disclaimer. As we observe, the problem for people with osteoarthritis is more on a structural problem, no? That means when we conduct conservative management, we cannot directly address the structural problem because it is inside the joint itself, no? But what we can do is, of course, control or manage the symptoms being experienced by the patient and prevent them from worsening, okay? Prevent them from worsening. And of course, same as before, we want the patient to be more functional despite the condition that they're experiencing. So what can we do as physical therapists? We can, of course, prescribe mobility exercises such as different range of motion exercises and joint mobility exercise. Strengthening exercise, mostly functional activities such as the one being shown in the picture, like doing squats, which is translated to sitting and standing. And then another one is joint protection techniques. So I've mentioned earlier that the pain is increased upon activity. So what we want to teach our patient is to do proper pacing of activities. Therefore, you have to provide yourself ample time for rest so that you would not experience increased pain on your joint. Okay, next one, teaching proper use of assistive device. So for this one, remember there is already an increased pressure on the joint itself. So what we do is, for example, we teach the patient how to use the cane or the walker, so that instead of using just their two legs for weight bearing activity, you add another leg in the presence of the cane, and so therefore your weight will be distributed into three legs, and therefore it will lessen the pressure on the affected joint. Okay, so in some severe cases, okay, patient might need to undergo joint replacement, or what we call arthroplasty. It's because there is too much damage that is happening on the articular cartilage, and there are development of bone spurs that impedes the function of your patient. So what happens for arthroplasty? So basically, they replace the articular cartilage with an implant. Okay, so this is the implant replacing in the femur and in the tibia. As you can see, so it could be a metal implant. So therefore, patient will now be able to move freely without experiencing the pain. Now, what will be the role of physical therapies for patients who undergo arthroplasty? So, patients can prepare themselves first before undergoing the surgery. So, we teach them how to protect the joint, to strengthen the joint, and how could they use their extremities, or how can they function well before the surgery, so that after the surgery, they would still be able to function well, and they would know how to manage their symptoms, even if they have already underwent replacement. Okay? So, basically, imagining na you have fresh legs, okay, fresh knees when you undergo arthroplasty. But, disclaimer, so, this is for severe cases of osteoarthritis. And of course, the orthopedic surgeon are the ones who are prescribing or talking with your patients with regards to the procedure. Okay, so still the patient should have a consent of whether they want or not to underwent arthroplasty, or they just want a conservative management. All right, that's it for today. Thank you for watching. I hope you find something meaningful from this video. And if you're interested for more, you may check them out. And I'll see you on the next one. Bye!